Assalamualaikum and good morning everyone. Climbing stair was chosen as our motion analysis for this project. This presentation is structured as follows: description of activity, steps of activity, motion analysis for upper and lower limb, and lastly, condition that affect individual.
Description of activity. According to Mendoza et al. 2018, stair climbing is one of the most fundamental activities of daily living and is necessary for independent living at home and in the community, such as a building, at school and supermarket, and public transport when we are boarding bus or airplane. Stair climbing is more challenging than walking because mechanical load on the lower limb, energy cost and dynamic instability are much higher during stair ascending than during walking. Although adults who have trouble climbing stairs have a smaller left space area regarding to their quality of life than those who do not. Furthermore, the majority of patients who are experiencing early to moderate osteoarthritis of the lower extremities, which is common in the elderly, describe difficulty climbing stairs as their primary complaint. Understanding the biomechanical principles of stair climbing is essential for conducting rehabilitation and design for public stairs. Next, steps of activity. First step, align with the stairs, body facing stairways. Step 2, lift right leg up to the first step and start climbing the stairs. Step 3, lift left leg up to the next step. Lastly, continue climbing the stairs until the end point.
Next subtopic is motion analysis of upper limb. The first step is standing aligned with the stairs and facing stairways. There is no motion required to perform the step. The joint of shoulder, elbow, wrist and fingers are in neutral position. Type of contraction is isometric and the plane is sagittal plane. Next, during climbing stair, trunk flexion is occur in 15 degree. The agonist muscle is rectus abdominis and for the antagonist muscle is erectus spinae. These two muscles is vital to keep the stability and maintaining the posture during the movements. The plane of this motion is sagittal plane. When the trunk is bent forward, it is in concentric contraction. Next, the upper limb involved is shoulder joint. The shoulder is flexed 19 degree. The agonist muscle are anterior deltoid and upper part of pectoralis major. And for antagonist muscle are posterior deltoid muscles, latissimus dorsi, teres major and minor. The plane of this motion is sagittal plane. When the arm is swing forward, shoulder flexor is in concentric contraction. Next, the shoulder joint is extend 12 degree. The agonist muscle are posterior deltoid muscles, latissimus dorsi, teres major and minor. And for antagonist muscle are anterior deltoid, pectoralis major and latissimus dorsi. When the arm is swing backward, shoulder extensor is in concentric contraction. The plane of this motion is sagittal plane. The elbow joint also involved when climbing stair to flex in 11 degree. The agonist muscle used is biceps brachii, while antagonist muscle is triceps brachii. When the arm is swing forward, there is concentric contraction at the elbow flexor. The plane of this motion is sagittal plane. Lastly, the wrist and fingers joint is in neutral position where there are no motion occurs in this step. The type of contraction is isometric and the plane of this position is sagittal plane. In upper limb, arm swing is a major part of balance and control while climbing the stairs. That reciprocal swing is important to maintain the balance.
Motion analysis on each step, lower limb. For starting point, lower limb was neutral. As you can see, in this step, we will align with the stair which facing the stair. It is condition when we will be ready to climb the stair. In this step, the action was neutral and the contraction was all isometric, which means all the muscle length will be remain the same. Next, for this step, we will start with rising the body onto the stair above. The muscle that are responsible to draw it up is the contraction of the soleus, quadriceps femoris, hamstring, and gluteus maximus. The gluteus medius at the same time prevent the body falling onto the unsupported side. As you can see, the range of motion of our hip joint on the right leg is 48 degree in flexion. The muscle responsible as the agonist for hip flexion is iliopsoas and quadriceps, and the antagonist is going to be hamstring, gluteus maximus, gluteus medius. It was concentric contraction, which is there is decrease in the length. For hip extension, the antagonist is going to be hamstring muscle, gluteus maximus, and gluteus medius, and the antagonist is going to be iliopsoas and quadriceps muscle. The type of contraction is concentric. For knee flexion, the right knee range of motion is 190 degree in flexion. The agonist is hamstring and gastrocnemius, and the antagonist is quadriceps femoris. It is all concentric, which the muscle tension rise to meet the resistance, then remain stable as the muscle shorten. For ankle dorsiflexion, the range of motion is 11 degree in slight dorsiflexion. The muscle agonist was tibialis anterior and the antagonist was gastrocnemius and soleus. The tibialis anterior dorsiflex the foot during the swing phase and help the limb to clear the stair on which the supporting limbs is placed. The type of contraction is eccentric.
Conditions that affect individual ability to perform the occupational activity. First is osteoarthritis or OA. OA is a type of joint disease that results from breakdown of joint cartilage and underlying bone. Symptoms of osteoarthritis are joint pain, stiffness, joint swelling, decreased range of motion, weakness or numbness of the arms and legs. Joint most commonly affected by osteoarthritis are the two near the ends of the finger, the joint at the base of the thumb, the big toes of foot, shoulder joint, the knee, hip joint, and the joint of the neck and lower back. Osteoarthritis often results in bone rubbing on bone. This illustration shows a healthy knee and a knee with osteoarthritis. Bone spurs are a common feature of this form of arthritis. People with osteoarthritis, which involves joint at the knee and hip joints and the joint at the lower back, will have problem to perform climbing stairs activity as they will feel pain or a dull ache and stiffness at the affected joint. Osteoarthritis affect people who are middle-aged or elderly. Other risk factors for osteoarthritis include obesity, previous injury to the affected joint such as fracture or dislocation, and family history of osteoarthritis. The second condition is amputation. The definition of amputation is the loss or removal of a body part such as finger, toe, hand, arm or leg. Amputation can be traumatic due to an accident or injury or surgical due to any of multiple causes such as blood vessel disease, cancer, infection, excessive tissue damage, dysfunction or pain. This picture consists of types of amputation. The types of upper extremity amputation: A. Partial hand amputation, B. Wrist disarticulation, C. Below the elbow amputation, D. Elbow disarticulation, E. Above the elbow amputation, F. Shoulder disarticulation, G. Four-quarter amputation. Double amputation is removal of both hands, feet, arm and leg. People with lower limb amputation are commonly affected as they will have problems with their ambulation, balance, and posturing to support their body weight when performing climbing stairs activity. The third condition is Parkinson's disease. Parkinson's disease is a brain disorder that causes unintended or uncontrollable movement such as shaking, stiffness, and difficulty with balance and coordination. Symptoms of Parkinson's disease usually begin gradually and worsen over time. As the disease progresses, people may have difficulty walking and talking. Four main symptoms of Parkinson's disease is tremor in hands, arm, legs, jaw or head, muscle stiffness where muscle remain contracted for a long time, slowness of movement, impaired balance and coordination, which sometimes leading to fall. People with Parkinson's disease often develop a Parkinsonian gait that includes a tendency to lean forward, take small, quick steps, and reduce swinging their arms. They also may have trouble initiating or continuing movement. Due to the symptoms, it will affect the people's ability to perform climbing stairs activity.
This is reference and thank you for listening.